With this, let's move on and let's talk about Narayana Health, and let's understand that how is the business shaping up right now. Let me welcome Sandhya, who is the Group Chief Financial Officer at Narayana Health, joining us on the show right now. Hi Sandhya, morning and good to be speaking with you. And firstly, let's talk about your India business. Help us understand how is the quarter shaping up for you in terms of the occupancy growth, and along with that, Sandhya, is the big GST rate announcement that has been made. Do you believe it can benefit the hospital sector in any way? Because there were cuts that were announced on medicine, medical devices and as well.
Good morning.
Good morning.
Thank you for having me here. So the hospital business, as you are aware, is cyclical. So Q1 and Q3 tends to be a little muted, and Q2 and Q4 tends to be slightly more robust. Beyond that, since the quarter is still underway, I would not be able to share more information. Most of our growth continues to be organic. No new capacity has gone live. Therefore, our growth will be in line with the organic growth that you can expect from the industry. GST is a very welcome change. For us, if you look at it, one aspect is the medicines. It's fallen from 12% to 5%. We buy about 500 to 600, 700 crores of or we sell about 600 to 700 crores of medicines in that category, and all of them will benefit from the GST reduction. In addition to that, there will be some savings that we will see in the capex cycle, as well as some savings in the medical equipment. According to us, the most important thing for healthcare is to be affordable and accessible. And any measure that enables bring the price of healthcare down to the end consumer is very, very welcome. So I am very sure that this will make healthcare a little bit more affordable for our patients.
Sandhya, with respect to your payer mix, the India domestic walk-ins clearly dominate at 47, right? But your international patients have dropped to 4%. Tell me, how do you see these numbers shaping up going forward, and what changes and challenges do you foresee ahead?
As a strategy, we are not pursuing international business. We were always getting a steady stream of patients from Bangladesh. At some point in time, it was 10 to 11% of our revenue. Post-COVID, it normalized at about 8 to 9%. And after the Bangladesh crisis, that has come down to about 4% or so. So we continue to serve the patients who are coming to us, but we are not actively pursuing to grow the international market, add more countries, because it's not a segment we want to play in. What is important for us is to keep a healthy balance between walk-in and insured patients. Over a period of time, we do want to increase the insured patients count, which enables also people to afford care. Most of the people who are walking in and paying in cash are not coming from affluent segments. They're actually coming in from segments where they don't have access to insurance or cannot afford insurance, and when a health event happens, it's catastrophic for families. So we would want that mix to shift to insurance over a period of time.
And Sandhya, a little bit more on your financials. If you take a look at your ARPOP, that's grown strongly, about 14% in Q1. How much more room are you seeing for ARPOP-led growth versus volume-led growth, given flat IP volumes in India?
So there are two aspects to the ARPOP growth. One is that Bangladesh reduction has contributed to the growth of the realization, because Bangladesh was a low realization portfolio for us. So when that got substituted by domestic patients, so there was some level of benefit that came into the ARPOP. The second is that the right measure to look at is average revenue per patient. ARPOP is a distorted measure because it looks at midnight occupancy. A lot of the procedures today are done on daycare basis. So therefore, if you look at the growth of ARPP, that is a better measure. The volume, the flatness that you see in the volume is also attributable to the same Bangladesh factor we spoke about. Given that our growth is an organic growth and we are adding capacities for the next 2 to 3 years, so our volume mix will grow at a moderate pace only. Our ARPP will grow based on factors such as if we are able to do higher order procedures. For example, we did the largest robotic cardiac procedures in the country. So that comes in at slightly higher realizations than the regular cardiac procedures. So that factor will also play in the growth of the ARPP and not just price change.
Sandhya, since you just mentioned about your capacity addition plans, believe that over 1900 new bed addition is what you're planning across Bengaluru, Kolkata and Raipur markets. What timelines are you working with and how confident are you on maintaining the margins as these new hospitals ramp up?
Our capacity additions are largely coming between FY28 and FY29. There will be, in the initial years, the impact of these facilities going live on the margins for sure. But the other way to look at it is that we are choosing to set up facilities in markets which are known to us and we have a reasonable brand strength. So our hope is that as and when these capacities go live, we will be able to commission and break them even faster than what we've done in the past. And therefore, we will be able to recover the margin dilution that will come in the initial period.
And Sandhya, on the expansion front, how much of your future capex will be funded internally versus via debt?
Most of it will be through debt only. Our debt EBITDA is very, very healthy at the moment. Debt equity, debt EBITDA, both are very healthy. We have a good headspace to borrow. We also have access to some very interesting and innovative financing models that banks have offered to us, which give us longer duration repayments, balloon repayments, etc., which is giving us little more capacity to expand. So almost 80% to 85% of the expansion will come through debt.
Okay, Sandhya, great to have you on the show. Good chatting with you as always.
Thank you.